With COVID-19, when we think high risk, we automatically think of seniors, but high risk can mean so much more. Denver 7's Eric Lufer is looking into how it's affecting people with Down syndrome and their caretakers, and he's at his home studio this morning.
Down syndrome continues to be the most common chromosomal condition. 1 in 700 babies are born with it. So I looked into how caregivers of those with Down syndrome need to go about the COVID-19 crisis. I reached out to 2 people heavily involved in this. First, Dr. Nicole Baumer with Boston Children's Hospital, who has a sister with Down syndrome, and Michelle C. Witten, the CEO of the Global Down Syndrome Foundation. Her daughter has Down syndrome. These 2 played a major role in partnering with other organizations to put together a Q&A for caretakers focused on COVID-19. Most people with Down syndrome are at high risk for COVID-19 because they have certain underlying medical conditions.
We are looking at them just like the typical population, and those underlying medical conditions that the CDC has said make you high risk would be the same for people with Down syndrome, except that we're just more inclined to have those.
But there's more to it than simply knowing your child or sibling is higher risk just because they have Down syndrome.
It may be harder for some people with Down syndrome to understand what social distancing means, how to, wash their hands for the right amount of time and to avoid handshakes and avoid touching other people.
Dr. Baumer says that's why it is that much more important to be extra vigilant if you are a caretaker of someone with Down syndrome. Also, self-isolating is key. By the way, if you want more information on this Q&A that was put together, we have a link under this story on our website, thedenverchannel.com, and on our free Denver 7 app. I'm Eric Lufer, Denver 7.